Hi everybody, welcome again to Dr. Manny's YouTube Learnshops, and in this session we're going to be looking at social sciences and how it relates to nursing, and this is part 1. The learning objectives for this are basically that you're going to have a comprehension of what healthcare was like from the classic era or antiquity right through history to present day 2020. And we'll be discussing, or reviewing anyway, healthcare during this period of time. So let's look at the classical era commencing from antiquity. Antiquity basically is from 2000 years before Christ and onwards. Today, from your perspective, you can be looking at Iban Shaman, Menang from what I understand, in the Malay, Boma, Dukan or Pawang. Hopefully I've got that right. But shaman held multiple roles as healers, magicians, rulers or priests, and as a healer they were responsible for preventing illness and curing the sick and the injured. Interestingly here, even here in Kuching, there are still shaman or Boma, Dukan or Pawang, from what I understand. During the period of antiquity, in the period of 420 BC, Hippocrates of Koch, also known as Hippocrates II, was a Greek philosopher and a Greek physician, and who's considered one of the most outstanding figures in the history of medicine or healthcare. He's often referred to as the father of medicine in recognition of his lasting contributions in the field of medicine. And he was the one that created the Hippocratic Oath, which basically said, do no harm. Also around this period of time, 400 BC, Huangdi Neijing published the Yellow Emperor's Classic of Internal Medicine, which lay the foundation for traditional Chinese medicine. As we evolve through antiquity, we go to the Roman period, approximately 50 AD. But in the Roman period there were lots of different terms like BCE, before the Common Era, and BC, before Christ. Basically they mean the same thing. Or CE in the Common Era. And this is the same as in the year AD, which is referred to as Anno Domini, and the latter refers to in the year of the Lord. However, St. Phoebe was the first nurse mentioned in the Holy Bible. She was commissioned by Pope St. Paul as the deaconess to serve the church. St. Phoebe exemplified early Christian ideals of charity, selflessness, giving care to the sick, orphans and travellers. During the period 129 to 16 AD, Galen was considered one of the greatest Greek physicians after Hippocrates. Clinical medicine based on observation and experience were his results. This result offered a complete medical philosophy that dominated medicine throughout the Middle Ages and until the beginning of the modern era. Galen was a physician, a surgeon, a philosopher in the period of the time of the Roman Empire, arguably the most accomplished of all medical researchers of antiquity. He influenced the development of many medical procedures. While there's slight controversy over who is technically the first nurse in history, Middle Eastern countries attribute the status of the first ever nurse to Rufaidah bint Saad. During the period of antiquity in Arabia, approximately 620 AD, she was acknowledged as the first Muslim nurse. She was also known as Rufaidah al-Salamiyah, and she learned her nursing and medical skills from her father, who was a traditional healer. And it was the Prophet Muhammad who gave her permission to set up and practice in a tent near Medina a Medina mosque to provide treatment and care for the ill and the needy after she proved herself leading a group of women to treat injured fighters on the battlefield. During the period of Antiquity, in the year 400 AD, Saint Fabiola was a nurse physician, and a Roman matron of rank in the company of noble Roman women who, under the influence of the Church, Father St. Jerome, gave up earthly pleasures and devoted themselves to the practice of Christian asceticism. She also established the first hospital in Latin Christendom, which was in Rome. As we approach the 1st century, this is still a period of antiquity. In the 1st to 14th century, nursing care was provided primarily by nurses or unskilled men and women. Some of the civilizations used slaves, the poor, or fallen, disreputed women to serve as nurses. Nursing at that point in time did not have a very professional reputation. During the 14th century, 1346 to 1353, the Bubonic Plague, or Black Death, was one of the greatest catastrophes ever, having killed approximately 200 million people, or about 60% of Europe's entire population. It's believed the Bubonic Plague was the result of an infectious fever caused by Bacterium Yersinia pestis, which was a disease that was transmitted from rodents, rats, to humans by a bite from infected fleas that came from these rodents. The symptoms spread widely and easily, indiscriminately killing young, healthy people, often in less than a week. Symptoms included dyspnea, fever, chills, extreme weakness, abdominal pain, diarrhea and vomiting, hemorrhage, shock and gangrene. In comparison to the symptoms of COVID-19, which affected older people because they were more susceptible because of their immunity, and they had serious symptoms because they were people who had comorbidities, which put them at risk. Transmission of the bubonic plague, or the pandemic of the Middle Ages, began in China and made its way to Europe, causing the death of about 60% of the entire European population, approximately 200 million at that time. As I indicated, the plague is caused by a bacterium, Yersinia pestis, and was carried by fleas from rodents to humans. The exposure was due to body fluids from a dead plague victim who was infected. Unlike bubonic plague though, however, COVID-19 spreads directly from person to person. It's extremely contagious. The contagious period still remains an issue which is yet to be determined. However, it affects older people primarily with comorbidities, whereas bubonic plague affected everybody who was bitten by the fleas from the infected rodents. Look at these plague doctors. Plague doctors were medical 14th century medical physicians who treated the victims of bubonic plague. And these physicians were specifically hired by the towns or cities where the plague had taken hold. Why do you think they wore a bird-like beak mask? Well, plague doctors wore a mask with a bird-like beak to protect themselves from being infected by deadly diseases, which they believed were airborne. They thought the disease was spread by a miasma, which was referred to as a toxic form of bad air. However, a lot of these doctors did become infected. and died. Look at another COVID-19 comparison. As far as the bubonic plague goes, pandemic termination, this plague ended through the implementation primarily of quarantines. The unaffected would remain in their homes and would only leave when it was necessary. Those who could afford to left the more densely populated areas to live in greater isolation, maybe in the country. In comparison, here in Malaysia, back in the villages. Here's a class activity, just for you to think about. What does the bubonic plague pandemic of Europe and Western Asia of the 14th century tell us about the pandemics like coronavirus contagion? Well, quarantine was important. It was implemented. Self-isolation and social distancing to curb the spread of the disease were considered important. Public health measures like hand hygiene, personal protective equipment use, cough etiquette, these are universal or standard precautions. In addition, compulsory burial and limits placed on overland travel movements, restrictions from state to state, area to area other than your immediate area were implemented. Remember the 3 cruise ships, COVID-19 contaminated passengers, they were refused to port. If we make a comparison back to 1665, trading nations of Europe were all afraid. And one of the authors, Daniel Defoe, who's very famous, he basically wrote, "No port of France or Holland or Spain or Italy would allow our ships entrance because we came from areas where potential spread of bubonic plague were considered problematic." In the 15th century, from the period 1400 to 1500, there were certain advances. However, these were considered turbulent times with unsafe conditions, quackery, which again was fake medicine, and the plague. However, it was a period of time when hospitals were being constructed. During the 16th century, 1500 to 1600, what were considered some... During this period of time, physical and psychological ailments that people experienced were thought to be the result of fluctuations in 4 bodily fluids. And they were referred to as being blood or sanguine, hot, related to a fiery personality, phlegm, cold, related to a calm personality, yellow bile, dry, bad-tempered personality, black bile, moist, melancholy personality. Interestingly enough, aspects that we discussed during behavioural sciences. It was also during this period of time that medical practitioners, as they were evolving, were hesitant to challenge established ideas with new observations and research. It was during this period of time, a period of enlightenment or understanding, especially in relation to human anatomy and physiology, that a founding figure, Andreas Vesalius, who in 1543 published a great anatomical reference. And it set a new standard for understanding human anatomy. It was also during this period of time, 1518, that the London College of Physicians was established. This was a small group of physicians led by a scholar, Thomas Linacre, who persuaded King Henry VIII at that time to establish this college. And subsequent to that, an Act of Parliament extended its powers from London to the whole of England in 1523. Another important figure at that time was Ambroise Parray, and he was a French barber surgeon who served numerous kings. King Henry II, Francis II, Charles IX, Henry III, and he's considered one of the fathers of surgery and modern forensic pathology. And he was a pioneer with surgical techniques and battlefield medicine. Although not the first to advocate ligature, he is responsible for introducing cauterization in relation to preventing or reducing hemorrhage. And he rediscovered the use of ligatures using a thread-like or wire material to constrict a patient's blood vessels. Philippus Aurelius Theophrasis Bombatus von Hohenheim, who called himself Paracelsus, is the man who pioneered the use of minerals and other chemicals in medicine. Poisons, which were considered at that time mercury, lead, arsenic and antimony, were cures in his view. Paracelsus considered himself an alchemist, like a pharmacist. However, his ideas on poison led to the introduction of chemistry into medicine in the 16th century. And although he wasn't fully appreciated at that time, it was after his death that medicine would be different in relation to his contributions. His ideas were even used to cure numerous kings. And he wrote a book on long life and the importance of public health. John Woodle was an English military surgeon, also considered a chemist, businessman, linguist and a diplomat. And he made a fortune through stocking the medical chests, or first aid kits if you want to think of it like that, for the East India Company, which was a big company at that time in the 16th century. He also is known for his authorship of a book called The Surgeon's Mate, which was a standard text to advise ships and their surgeons on medical treatments while at sea. And it contains an advanced view on the treatment of how to treat scurvy. He was responsible for introducing lemon juice to treat scurvy, which was problematic for British seamen at that time. And others, I guess, as well. In the 17th century, between the period 1600 to 1700, the following advances were made. During this period of time, very little was known about hygiene. People were not aware that disease was spread by germs, which thrived on dirt. They didn't think about washing their hands before eating or after cleaning the streets, so diseases spread quickly. During this period of time, William Harvey, who was an English physician, made influential contributions in anatomy and physiology. He was the first known physician to describe completely and in detail the systemic circulation and the properties of blood being pumped to the brain and the rest of the body. He showed that arteries and veins form a complete circuit that start at the heart and lead back to the heart. And he published a very influential book in 1628, which was called The Anatomical Disquisition on the Movement of the Heart and Blood. In 1674, Anton Van Leeuwenhoek invented the first practical microscope and became the first person to see and describe red blood cells, bacteria and protozoa. He laid the foundation for microbiology. He is considered to be the father of microbiology. In the 18th century, between the period of 1700 and 1800, the advances that were being made were modern hospitals were starting to form. But however, they only formed and served medical needs and staffed by only trained physicians and surgeons. Nurses were untrained workers, and they only made the following contributions. They warmed beds, they provided heating pads, and they provided herbal remedies. Family members cared for most of the sick or the infirmed. During this period of time, an English scientist, Joseph Priestley, discovered oxygen. He also discovered nitrous oxide, nitric oxide, ammonia, and hydrogen chloride. Edward Jenner, an English country doctor, introduced the vaccine for smallpox. He was working in an agricultural community. Jenner knew the country folklore that milkmaids never caught smallpox. He speculated that a bout of cowpox produced immunity against smallpox. As a forward-thinking doctor who liked to experiment, Jenner wanted to prove his theory. So, in 1796, he inserted pus, purulent fluid, taken from Sarah Nelms, a milkmaid with cowpox, and introduced it into a cut from a local boy, James Phipps. Several days later, Jenner exposed the boy to smallpox and found that the boy was immune. Jenner called this new method vaccination, after the Latin word for a cow, vacca. In the 19th century, the period between 1800 and 1900, numerous advances were evolving. In this period of time was the development of anaesthesia. A chemist, Humphrey Davy, recognised the analgesic properties of nitric oxide when he inhaled it himself while he had a toothache, and as a consequence he coined the term laughing gas. Dentist Horace Wells in 1844 first used nitrous oxide to anaesthetise his patients. Dr. William Morton demonstrated ether anaesthesia at the Massachusetts General Hospital in the USA. Dr. James Young Simpson in 1847 administered chloroform to a woman who was in childbirth. Looking at Sir Humphrey Davy, he's best remembered for his discovery of potassium and sodium and other ions like calcium, barium, magnesium and boron. It was in 1816 a French physician, René Laennec, invented the stethoscope while working at the hospital Nectar. Sir James Blundell, a British obstetrician, performed the first successful transfusion of human blood to a patient for the treatment of postpartum hemorrhage. He hoped the transfusions would save lives of many women who would otherwise die from hemorrhage postpartum following childbirth. Sir Joseph Lister was a prominent physician, and he was the founder of antiseptic medicine and aseptic surgery. He was a professor of clinical surgery. He introduced carbolic acid, now known as phenol, to sterilise surgical instruments and to clean wounds. And he applied Louis Pasteur's advances in microbiology. He was a champion for the use of carbolic acid as an antiseptic, so that it became the first widely used antiseptic in surgery. He's considered to be the father of modern antiseptic surgery. Ignaz Semmelweis, in the late 1840s, this was a German-Hungarian physician who was working in an obstetric clinic in Vienna and was alarmed that many of the women postpartum were developing puerperal fever, becoming septic and dying. And he observed the infectious nature of this process, and he developed an antiseptic technique to prevent the condition, which we today call hand hygiene. I mean, he's considered as the father of hand hygiene. However, in his day, he wasn't taken seriously by his medical peers because his theory of disease was not accepted back then. It was rejected. And he was subjected to ridicule, ostracism. His career was ruined. His wife left him. His life was ruined because of the theories that he was coming up with were so repugnant to his positivist contemporaries. It didn't seem evidence-based. But he is considered the father of hand hygiene. Florence Nightingale, a brief history. Founder of modern nursing, born May 12, 1820, became a nurse at a time when the nursing profession was considered a degrading occupation and hospitals were disease-ridden. She's known as the Lady of the Lamp, a British nurse, a social reformer, a statistician. Her experiences primarily as a nurse came from the Crimean War, and this is where she laid her foundational views about health and sanitation. Some additional points. She was born in Florence, Italy, and that's how she got her name. At first her family didn't want her to become a nurse because they didn't think it was a very nice job to have, but she was determined and got their consent. She treated the wounded soldiers during the Crimean War and made sure all the hospitals were clean, and the soldiers were very grateful for her care and kindness because most of them at that time, before her interventions, were dying of sepsis as a result of the poor hygiene. During the Crimean War, as I indicated, she was nicknamed the Lady with the Lamp because she would work all night to make sure the soldiers were cared for and they got what they needed, like water and warm blankets. In 1883, Florence Nightingale met Queen Victoria, who awarded her the Royal Red Cross Medal to thank her for all her hard work as a military nurse. In 1860, she set up the Nightingale Training School for Nurses at the St Thomas Hospital in London, which is still there today. She was also a talented mathematician who proved using statistics that keeping hospitals clean has a beneficial effect on patients' recovery rates and outcomes. She was the first woman to be elected to the Royal Statistical Society. International Nurses Day is celebrated every year on the 12th of May, her birthday. It's thanks to Florence Nightingale's work and achievements that people view nursing in a more positive, respectable way. The International Red Cross, which was founded thanks to her work, awards the Florence Nightingale Medal to nurses who have given exceptional care to people who are sick, wounded, whether in war or peace. She made considerable influences in medicine and nursing. In 1870, two prominent scientists, Louis Pasteur and Robert Koch, established the germ theory of disease. Louis Pasteur was a French chemist and microbiologist, and he's considered one of the most important founders of microbiology for his innumerable contributions to the field. He's also known as the father of microbiology because he's also renowned for his discoveries of principles to do with vaccination, microbial fermentation, and his namesake pasteurization. Robert Koch was a German physician and also a microbiologist, and also one of the main founders of modern bacteriology. Louis Pasteur established bacteriology as a science. He used pasteurization, which meant that fluids such as milk should be heated to a temperature of 60 to 100 degrees centigrade, pasteurization, and this would destroy microbes. He was responsible for an anthrax vaccine and a rabies vaccine. In 1895, Wilhelm Conrad Roentgen, a German mechanical engineer and physicist, produced and detected electromagnetic radiation in a wavelength range known as X-rays, or sometimes referred to as Roentgen rays. This achievement earned him the first Nobel Prize in physics. These X-rays were a new kind of rays that took the world by storm. It revolutionized medicine. Advances in the 20th century, the most important or significant. Karl Landsteiner was an Austrian American immunologist and pathologist, and he received the Nobel Prize for Physiology and Medicine in 1930 for his discovery of major blood groups and the development of the ABO system of blood. He revolutionized medicine as a consequence of that. In 1901, a clinical psychiatrist and neuroanatomist, Alois Alzheimer, reported a peculiar severe disease process of the cerebral cortex, and he reported it to the 37th meeting of the Southwest German psychiatrists in Tübingen, Germany. He described a 50-year-old woman who he'd followed from admission for paranoia. This woman was Augusta Detter, who was the first person officially diagnosed with Alzheimer's disease. And she started to show signs of the disease when she was only in her early 50s. However, he's responsible for identifying the first case of what becomes known as Alzheimer's disease. In 1903, Willem Einthoven invents the EKG, or the ECG, or electrocardiography. He's a Dutch physiologist who was awarded the Nobel Prize for Physiology or Medicine in 1924 for his discovery that electrical properties of the heart can be monitored or recorded through an electrocardiograph. So therefore, he developed the doctor's ability to depict heart or parts, functions and illnesses using ECGs. And his process was using a string galvanometer which measured tiny currents. The picture that you can see to the right, that's the first ECG machine, and the person sitting there is his first patient. And rather than electrodes, he's got 3 buckets of salt water for the right arm electrode, left arm electrode, and the left leg electrode. In 1927, the BCG, Bacillus calmette guerin, the first vaccine for tuberculosis. Basically, the vaccine starts with Albert Calmette and Camille Guerin, and they were 2 French scientists who from 1905 had been working on developing a vaccine against tuberculosis. Both were physicians, bacteriologists and immunologists, and they were working through the Pasteur Institute when they made these discoveries. In 1928, Sir Alexander Fleming made another important contribution. He discovered penicillin made from the Penicillium nocturdum mold, and he was the first to discover the first true antibiotic. He was a professor of bacteriology and he practiced at St Mary's Hospital in London. He received the Nobel Prize in Physiology or Medicine for his discovery in 1945. Another important figure at this time was Claude Chauffeur Beck, and he was a pioneer. He was an American cardiac surgeon. He was famous for innovating cardiac surgical techniques and performing the first internal defibrillation. He was the first American professor of cardiovascular surgery. He was also an important figure for cardiopulmonary resuscitation techniques that were beginning in the early 1950s. But he's remembered for the first internal defibrillator during open chest surgery. In 1950, public health was also evolving. Safety of food and water in the United States, but certainly other countries as well. In 1900, the contaminated food and water caused typhoid fever, tuberculosis, botulism and other foodborne diseases, and sanitation, refrigeration and pasteurization improved safety of food being supplied and the water being supplied. In 1950, public health improvements also involved vaccines and vaccinations globally. Prior to immunizations, people routinely died from infectious diseases. Vaccines eradicated smallpox globally, poliomyelitis, and had a dramatic effect on reducing measles, diphtheria, rubella, pertussis, and other communicable diseases. Vaccines protected entire populations by preventing the spread of disease from one individual to another. In 1952, Dr. Jonas Salk was an important figure. He created the first polio vaccine, and he used an inactivated polio virus, and it was given by injection and eliminated the risk of developing polio. At that time, it was an epidemic year for poliomyelitis, and there were 58,000 new cases reported in the United States, and more than 3,000 of those cases died from the disease. Another important figure at that time was Dr. John Haysham Gibbon, and he invented cardiopulmonary bypass, which again we know as, in lay terminology, the heart-lung machine. And it was first used on an 18-year-old female who had a serious septal defect between the upper chambers of the heart. She was able to be operated on, the defect was able to be closed, and she recovered. Another important figure at that time was William Conandhoven, and he was responsible for creating the external defibrillator, and it was used for the first time in 1957 to save the life of a patient with ventricular fibrillation at Johns Hopkins Hospital. He was also known as the father of cardiopulmonary resuscitation because he was famous for the development of his closed chest cardiac massage, CPR. In 1960, Dr. Albert Bruce Saban, a Polish-American medical researcher, is best known for developing an oral polio vaccine, which has played a key role in eradicating the disease. However, as indicated, there is a small risk of developing polio after receiving this weak oral polio vaccine. and in many countries it's still used. In many countries it's still used. In the USA it hasn't been used since the year 2000 because of this small risk of developing polio. So in preference they use the injectable polio vaccine. 1967, Professor Christian Barnard, cardiac surgeon, South African. The hospital was the Groote Schuur Hospital. He performed the first human-to-human transplant, and the patient, Louis Washansky, a 54-year-old grocer, had severe heart disease. It was incurable. It required a heart transplant. He also had a history of diabetes. Unfortunately, Mr. Louis Washansky only lived for 18 days, but he didn't die of complications related to the surgery. He died of pneumonia, probably because he was immunosuppressed as well, which happens after heart transplantation. As far as Dr. Barnard goes, although the patient only survived for 18 days, 4 of his other patients survived for more than a year, 2 living for 13 and 23 years respectively. In 1915, during the period to 1997, public health improved as well. Maternal and infant well-being in the US and most other developed countries improved dramatically. In 1900, for example, for every 1,000 live births, 6 to 9 women in the US died of pregnancy-related complications, and approximately 100 infants died before the age of 1 year. During that period of time as well, maternal mortality rate declined almost 99% to less than 0.1 reported deaths per 1,000 live births, and infant mortality rate declined greater than 90% to 7.2 per every 1,000 live births. Environmental interventions, improvements in nutrition, advances in clinical medicine, improvements in access to healthcare, improvements in surveillance and monitoring of disease, increases in education levels of the public, and improvements in standards of living all contributed to these remarkable declines. During the same period of time, prevention and control of infectious diseases in developed countries improved dramatically, with a combination of improved sanitation, immunisation programs, antibiotics, access to medical care. Deaths from infectious diseases declined remarkably. In the 1900s, for example, the 3 leading causes of death were pneumonia, tuberculosis, diarrhea and enteritis, which caused 1/3 of all deaths. Of these deaths, 40% were children aged less than 5 years. Currently, in the year 2020, only influenza and pneumonia are in the top 10 leading causes of death. During this period of time, 1914 to 2000, nursing evolved. There was a World War I, II, the Korean War, the Vietnam War, and during this period of time, nurses served to care for the wounded. Nightingale's achievements overshadowed other ways to nurse the sick. It showed the way to improve nursing care, medical care, health care. Hospitals established their own training schools for nurses and provided skilled, compassionate care as a consequence. Nursing models were humanised and they evolved so that impersonal medical care procedures weren't as severe. In 2001, the first telesurgery was performed on a patient with a gallbladder who was in Strasbourg, Germany, whereas the surgeon was in New York. This was Dr. Jacques Marseilles. And telesurgery emerged as a surgical system that utilised wireless networking and robotic technology to connect surgeons and patients who were distantly located from one another. And it's evolved dramatically since then. This was 19 years ago. In 2003, Dr. Carlo Urbani, and I mention this because of COVID-19 similarities which you'll see. And Carlo Urbani was an Italian doctor and a microbiologist who first identified severe acute respiratory syndrome as a new and dangerously contagious viral disease. He alerted the World Health Organization to the threat of the SARS virus, and it triggered the most effective response to the epidemic in history. Unfortunately, Dr. Urbani died from the disease himself in less than a month after contracting it. In 2013, stem cell technology started to evolve. Tiny functioning human kidneys and livers have actually been grown from stem cells in a laboratory by scientists in the US and in Japan. I mention this one out of respect. In 2019, Dr. Li Wenliang, he was hailed a hero for raising the alarm about COVID-19 coronavirus, just as Dr. Urbani did with the World Health Organization. He alerted people to the fact about the outbreak, and he also subsequently died of the infection. He was only 33 years old. Let's briefly review the historical pandemics that have occurred since Antiquity up to the present day. But I'm not going to go through all of them. I'm just going to briefly go through them just for your interest. The first epidemic recorded approximately 3,000 years before Christ, BC. It's referred to as the Prehistoric Epidemic. And about 5,000 years ago, an epidemic wiped out a prehistoric village in China. The bodies of the dead were stuffed into a house that was later burned down. No age group was spared, as the skeletons of the juveniles, young adults and middle-aged were found inside the house by archaeologists. The archaeological site, which is now called Hamin Manga, and it's one of the best preserved prehistoric sites in northeastern China. Archaeological and anthropology studies indicate that the epidemic happened quickly, enough so there's no time for proper burials, and the site was not inhabited again. The picture that you're seeing are all the skeletons. Then you've got the plague of Athens, 430 BC. And around 430 BC, not long after the war between Athens and Sparta began, an epidemic ravaged the people of Athens that lasted for about 5 years. Some estimates put the death toll as high as 100,000 people. The Greek historian Thucydides, he's generated between 460-400 BC, wrote that people in good health were all suddenly attacked by violent heats in the head, and redness and inflammation in the eyes, and the inward parts such as the throat and the tongue becoming bloody and emitting an unnatural and fetid breath. The Antonine Plague, 165-180 AD. This was when soldiers returned to the Roman Empire after campaigning, fighting wars. They brought back more than the spoils of victory. They brought back the Antonine Plague, which may have been smallpox, and it laid waste to the army and may have killed over 5 million people in the Roman Empire. The Black Death, 1346 to to 1353. The Black Death travelled from Asia to Europe, which I mentioned earlier in this session, leaving devastation in its wake. Some estimates suggest that it wiped out over half of Europe's population. We said about 200 million. We said about 60%. It was caused by a strain of bacterium, Yersinia pestis. It's likely extinct today and was spread by fleas on infected rodents, rats. The bodies of the victims were buried in mass graves. The plague changed the course of Europe's history. With so many dead, labour became harder to find, bringing about better pay for workers, and at the end of Europe's system of serfdom, slavery, studies suggest that surviving workers had better access to meat and higher quality bread. The lack of cheap labour also may have contributed to technical advances or innovation. I've eliminated others and skipped through to the American plagues of the 16th century. The American plagues were a cluster of Eurasian diseases brought to the Americas, called then, by European explorers. These illnesses, well, diseases, included smallpox, contributed to the collapse of the Inca and Aztec civilizations. Some estimates suggest that 90% of the indigenous population in the Western Hemisphere were killed off as a result of this. The diseases helped the Spanish force, led by Hernan Cortes, conqueror of the Aztec capital, in 1519, and another Spanish force led by Francisco Piazza, conqueror of the Incas, in 1532. The Spanish took over the territories of both empires. In both cases, the Aztec and Incan armies were ravaged by disease and unable to withstand the Spanish forces. When citizens of Britain, France, Portugal and the Netherlands in the future began exploring, conquering and settling the Western Hemisphere, they were also helped by the fact that the disease had vastly reduced the size of any indigenous groups that opposed them. The Great Plague of London, 1665-1666. The Black Death, the last major outbreak in Great Britain, caused by a mass exodus from London. Led by King Charles II, the plague started in April 1665, spread rapidly through the hot summer months. Fleas from plague-infested rodents were one of the main causes of the transmission. By the time the plague ended, about 100,000 people, including 15% of the population of London, had died. But this was not the end of the city's suffering. On September 2nd, 1666, the Great Fire of London started, lasting 4 days, burning down a large portion of the city. Gee, that may have killed a lot of the rats as well. May have been beneficial, actually. The Great Plague of Marseilles in France, 1720 to 1723. Historical records say that the Great Plague of Marseilles started when a ship called the Grand Saint Antoine docked in Marseille, France, carrying a cargo of goods from Eastern Mediterranean. Although the ship was quarantined, plague got into the city, likely again through fleas on plague-infested rodents. The plague spread quickly, and over the next 3 years, as many as 100,000 people may have died in Marseille and the surrounding area. It's estimated that up to 30% of the population of Marseille perished. Philadelphia, yellow fever epidemic, 1793. When yellow fever seized Philadelphia in the United States, it was the capital of the United States at that time. Officials wrongly believed that slaves were immune, and as a result, abolitionists called for people of African origin to be recruited to nurse the sick. The disease is carried and transmitted by mosquitoes, which experienced a population boom during the particularly hot and humid weather in Philadelphia that year. It wasn't until winter arrived and the mosquitoes died out that the epidemic finally stopped, and then more than 5,000 people had died. The flu pandemic of 1889-1890. In the modern industrial age, new transport links made it easier for influenza viruses to wreak havoc. Yeah, well, look at what happened with COVID-19. Look at what happened with H1N1 from air transport by comparison. In just a few months, the disease spanned the globe, killing 1 million people. It took just 5 weeks for the epidemic to reach peak mortality. The earliest cases were reported in Russia. The virus spread rapidly through St. Petersburg before quickly making its way through Europe and the rest of the world, despite the fact that air travel didn't exist yet. So air travel would have increased it dramatically. When you look at the American polio epidemic of 1916, the president at that time was diagnosed with polio in 1921 at the age of 39. Polio killed thousands until the development of the Salk vaccine, which we discussed just previously in 1954. This polio epidemic started in New York and caused 27,000 cases and 6,000 deaths. The disease mainly affected children and sometimes left survivors with permanent disabilities. The polio epidemics occurred sporadically in the United States, as I said, until the Salk vaccine developed in 1954. And as the vaccine became widely available, cases in the United States declined. The last polio case in the United States was reported in 1979. Worldwide vaccination efforts have greatly reduced the disease, which we mentioned previously, but is not completely eradicated. The Spanish flu. In 1918-1920, it's estimated 500 million people from the South Seas to the North Pole fell victim to the Spanish flu. 1/5 of those died, with some indigenous communities pushed to the brink of extinction. The flu spread and lethally was enhanced by cramped conditions of soldiers and poor wartime nutrition that many people were experiencing during the First World War. Despite the name Spanish flu, the disease didn't start in Spain. Spain was a neutral nation during the war and did not enforce strict censorship of its press, which could therefore freely publish early accounts of the illness. As a result, people falsely believed the illness was specific to Spain, and the name Spanish flu stuck. The Asian flu, 1957 to 1958. The Asian flu was a pandemic, and it was another global showing of the influenza. With its roots in China, the disease claimed more than 1 million lives. The virus caused the pandemic, and it was a blend of avian flu viruses, bird flu. The Centre for Disease Control and Prevention noted that the disease spread rapidly and was reported in Singapore in February 1957, Hong Kong April 1957, and the coastal cities of the United States in the summer of 1957. The death toll was more than 1.1 million worldwide, with 116,000 deaths occurring in the United States. The AIDS pandemic epidemic, 1981 to present day. AIDS has claimed an estimated 35 million lives since it was first identified. HIV, which is a virus that causes AIDS, likely developed from a chimpanzee virus, an ape virus, a monkey virus, and was transferred to humans in West Africa in the 1920s. The virus made its way around the world, and AIDS was a pandemic by the late 20th century. Now, about 64% of an estimated 40 million living with HIV live in sub-Saharan Africa. For decades, the disease had no known cure, but medication developed in the 1990s now allow people with the disease to experience a normal lifespan with regular treatment. Even more encouraging, 2 people have been cured of HIV as of early 2020. H1N1 swine flu pandemic, 2009-2010. The 2009 swine flu pandemic was caused by a new strain of H1N1 that originated in Mexico in the spring of 2009 before spreading to the rest of the world. In 1 year, the virus infected as many as 1.4 billion people across the globe and killed between 150,000 to 575,000 people according to the CDC. The 2009 flu pandemic primarily affected children and young adults, and 80% of the deaths were in people younger than 65, reported by the CDC. That was unusual considering that most of the strains of flu viruses, including those that cause seasonal flu, cause the highest percentage of deaths in people aged 65 or older. They have comorbidities. But in the case of the swine flu, H1N1, older people seem to have already a built-in immunity, so they weren't affected as much. A vaccine for H1N1 virus that caused the swine flu is now included in annual flu vaccinations in the United States. The African or West African Ebola epidemic of 2014-2016. Ebola ravaged West Africa between 2014 and 2016 with 29,000 reported cases and approximately 12,000 deaths. The first case to be reported was in Guinea in December 2013. Then the disease spread quickly to Liberia and Sierra Leone. The bulk of the cases and the deaths occurred in those 3 countries. The smaller number of cases occurred in Nigeria, Mali, Senegal, the United States, Europe, and the Centre of Diseases reported these facts. There's no cure for Ebola, although efforts at finding a vaccine remain ongoing. The first known cases of Ebola occurred in Sudan and the Democratic Republic of Congo in 1976, and the virus may have originated in bats. The Zika virus epidemic, 2015 to present day. The impact of the Zika epidemic in South America and Central America won't be known for several years. In the meantime, scientists face a race against time to bring the virus under control. The Zika virus is usually spread through mosquitoes, although it can be sexually transmitted in humans. While Zika is not usually harmful to adults or children, it can attack infants that are in the womb, and it can cause birth defects. The type of mosquitoes that carry the Zika flourish in warm, humid climates, making South America, Central America, and parts of southern United States prime areas for the virus to flourish. Let's look at us. The COVID-19 pandemic, 2019 to the present. The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing global pandemic of coronavirus disease caused by severe acute respiratory syndrome coronavirus, SARS-CoV-2. The outbreak was first identified in Wuhan, China in November 2019, and the World Health Organization declared the outbreak a public emergency of international concern on January 30th, 2020, and a pandemic on March 11th, 2020. As of 26th of June 2020, more than 9.6 million cases of COVID-19 have been reported in more than 188 countries and territories, resulting in more than, nearly 500,000 deaths. More than 4.8 million people, however, have recovered. The pandemic has caused global, social and economic disruption, which includes the largest global recession since the Great Depression. It's also led to the postponement of cancellation of sporting, religious, political and cultural events, widespread supply shortages which exacerbate panic buying, and decreased emissions of pollutants and greenhouse gases. Schools, universities and colleges have been closed either on a nationwide or local basis in 172 countries, which has affected approximately 90.8% of the world's student population. Misinformation about the virus has circulated through social media and mass media. There have been incidents of xenophobia and discrimination against Chinese people and against those perceived as being Chinese or being from areas of highly infectious rates. So let's move on now to the 21st century, which is now 2001 onwards to 2100, or the year 2100. What are some advances? Artificial organs. Time and resources are being devoted to growing artificial organs in laboratories, and studies have been done with stem cells that have proven that it's possible to grow organs in a laboratory which could then be implanted into a human being. HIV Aids Treatments. Combination of drug therapy extends HIV survival, as we've just indicated, and again, there have been some people that have been cured of HIV. The FDA have approved a number of combinations in antiviral medications. Functional MRI, which is magnetic imaging, which allows scientists to see what the brain actually does. Controlling heart disease. Deaths due to heart disease have dropped significantly over the past 10 years. Heart disease has dropped by 40%. Anti-smoking laws and campaigns reduce, I hope, public smoking. Targeted therapy for cancer. Target and attack cancerous cells, leaving healthy cells alone. Targeted therapies for cancer expand with new drugs. Cyberknife technology. As we've indicated previously, 2001, the use of combination of robotics, imaging, telemetry, television. You can operate from at a distance. Bionic prosthetics. Hands, arms, feet, legs can be used, and they can be used here via iPad applications. Nanomedicine. Disease can be targeted without harming surrounding tissue. 3D printed body parts. The primary use of printable organs is for transplantation and are still subject to active research, but they're evolving. Laparoscopic surgery. Minimally invasive and robotic techniques revolutionise surgery. It's already being performed at this present point in time. New classes of antibiotics. New groups of antibiotics with unique approach to attacking bacteria have been discovered, making it promising as in the clinical area against microbial resistance. And 12, completion. Human genome discoveries. So genetic tests can be used to treat, cure and even prevent thousands of diseases. Medical information technology evolving. Healthcare uses information technology to increase patient safety. Patients get barcode which matches their therapies and interventions. Stem cell research which we've mentioned, clinical and laboratory advances. So in conclusion, effective treatment and prevention of disease has extended life expectancy and reduced disability. beyond the most optimistic hopes of physicians even a few decades ago, let alone those coming from the time of Antiquity, which we reviewed. Far beyond the dreams of their predecessors 1,000 years ago. We are no more able than they were, however, to predict what this new, exciting millennium will bring. Some of the advances being developed currently are most amazing. Thanks everybody, that's the end of this session. If you've enjoyed it, please recommend it to your colleagues, your friends, and check out some of the other Dr. Manny Learnshops on YouTube. Bye for now.